Okay, it is 6:04 at this point. It looks like we have currently 75, 76 people on Zoom and another group of people that are watching on YouTube for this first of two community forums that I've scheduled for today. So I just want to take a minute to thank you for joining, and hopefully we can provide as much information as possible at this point in time. I know we are really close to the start of the school year. We've been working really hard to prepare, but things could change, and we continue to monitor the situation, listen to guidance that we're getting from the Department of Ed and the Department of Health. And so things can still be fluid. We are going to share with you where we are at the current time, and if and when things change, we will continue to send out regular communications as we did throughout the previous year and the last of the year prior to that. So we're entering year three, school year three of this crisis that we're facing. And I just want you to know that ultimately our goal is to keep all children in school in person, starting on day one until the end of this school year, regardless of what happens. And so that is a huge responsibility. And I think we handled it really well last year, and I have no doubt that we will continue to do that throughout this year. So a little bit of background information. I know we're a little bit late in sharing information. That is not because we haven't been working and talking about our plans for reopening, but the guidance that we were waiting for from the Department of Education and the Department of Health was released to us on August 1st. And I happened to be away on vacation, not to a hot spot, just to a beach house, only with my family. And I was there from the 1st until the 6th. So I returned after on the 10th, which was the first school day back. And that's when we kind of put together our responses to this initial template. And this template really deals with mitigation strategies, safety, health and safety decisions, policies, those kinds of things. So the information is very new, and it's not that we've been sitting on it, it's just that we were waiting for the guidance and the template that we needed to complete to submit to the Department of Ed. I also just want to say before we begin that some of the topics that we're going to talk about today are, as everybody knows, hot topics. Many people have sent in letters expressing their opinions about certain strategies, mostly masking policies. And I read every email that I receive, and I understand really clearly that there are polar, opposite, and opposing views on the matter. There are individuals who do not want there to be any rules about mask wearing, and there are individuals who want mandatory mask wearing for everybody. So, and there don't seem to be many people who are expressing an opinion that falls somewhere in the middle. So that's the world that we currently live in. And I think everybody is entitled to their opinions, but clearly, no matter what we decide, there are going to be people that disagree with that decision. And so we understand that we're in a really difficult spot. And so my job and the job of our administrators is to make sure that we're paying attention to all of the information that we know. We make sure that we understand the perspectives of the people that we serve, and we make the best decisions that we believe will maintain safety for our children, but also consider the perspectives of our community. And in this case, the perspectives vary from one extreme to the other. So I think that what I'm going to do today is begin the conversation about masking, because I think that's the reason most of you are on. I know you're probably interested in everything, but this is the biggest topic. And I will say that we worked really hard to come to a recommendation. This is only a recommendation because it has not gone in front of the school committee yet. The school committee meets tomorrow, and they will discuss and ultimately vote on the policy. But I will share with you what my recommendation to the school committee is. And it is a compromise. And what that means is I've listened to both sides of the argument, and I think that we've come up with something that gives neither side of the argument exactly what they're looking for, but does take into consideration the data, the local data, not the United States data, not the Rhode Island data, but the data that exists for Exeter and West Greenwich. That seems to be one of the major arguments for not having masks, that over the course of this pandemic and during an extended period of time last year, there were months where our community transmission rate, as defined by the Department of Health, was in the lowest category. And for periods of time, in fact, there was a 2-month stretch, and even into July, where our community transmission rate was 0, meaning that for all of the tests that took place, there were 0 positive cases per 100,000 residents, which put us in the lowest category. And at that point, people were saying, you have to pay attention to the local data. And why would we be masking when there is 0 transmission in the town? So that's a perspective that I can understand. We are currently not there. There are things that are changing. The Delta variant is out. We're seeing another spike. However, I do not want to come out with a mask mandate for everybody, and I do not want to come out with a no mask mandate. What I have done is tied the decision, meaning the decision is fluid, to community transmission. So if we are in periods of lower transmission, then the restrictions are lifted or relaxed. And if we are in the periods of the highest transmission, then we move to the higher mitigation strategies. So it gives both sides of the argument something, but it also pays attention to the science, the recommendations of the CDC, and the desire of the community. So that's where I am at this point. I'll be really specific about what the policy says, and this is a recommended policy, again, up for discussion at the school committee, which is scheduled for tomorrow. What we are suggesting is that during periods of low community transmission, and that's defined by the Department of Health and the CDC, masks would be optional for all individuals, regardless of vaccination status. During periods of moderate transmission, which is the next level up, masks would be optional for those who are vaccinated and mandatory for those who are not. And then during periods of substantial to high transmission, masks would be mandatory for all, regardless of vaccination status. And I will say that last year, for the majority of the school year, we were not in periods of substantial or high transmission. And I suspect that we will get there again. But at the current time, we are in a period of substantial transmission in both towns. And the individuals that are impacted are changing, meaning that last year we did not see much transmission or positivity occurring in young children. There were cases, but the rate was really low. Now we're seeing more cases of younger individuals who are testing positive and testing positive with the Delta variant. So at the current time, we are in substantial transmission and very close to the highest level, the high transmission rate. So that's our reality. I also want to say that while many people have pointed out that to date, the impact on children has been limited, meaning that we have not had deaths in Rhode Island. Most children are not ending up on ventilators like a lot of our older individuals, our older Rhode Islanders. But the school is a location that includes more than just children. And we have staff, we have elderly staff, we have staff who are compromised, and they are part of who I need to protect as well. So this is not just about children. This is about your children and your children's teachers and staff who are there to support them. So I do need to care about the impact of a positive case on both kids and adults. So my policy that I recommend to the school committee is different than what we are being told, from both sides of the argument, but also different than any of the recommendations that we're getting from the Department of Health. Everything seems to be very black and white, and nothing I've seen ties decisions to community spread, but that's what we've done. I have shared my recommendations, which I think is a decent compromise with surrounding communities, and the policy that's going to the school committee tomorrow for review is one that is also being considered in most of the communities that surround us, because most people believe that it does reflect the opinions and the desires of both sides of the argument. And again, it doesn't give either side exactly what they're looking for, but I think it does reflect our attention to what's happening locally. And by locally, I mean in our two communities. So that's where we stand at the current time. And I'm happy to take questions. I know that there are people that want to make arguments for and against. And I just want to be honest with you. I am not an epidemiologist. I do not have a degree in science. I did not train to manage a pandemic. I have to rely on information that is shared with me. So any argument that includes science is not something that I am able to respond to because I have no context with which to respond. I have information. I use the information to make the best decisions that I can. And I think it worked last year. And I hope that you understand that we are in a really difficult spot, and I'm doing the best that I can at this point. So I will move on to the other mitigation strategies and decisions. There actually are some things that have been relaxed from last year. I see a lot of questions that are popping in. I think I'm going to answer most of them, but then I'm happy to respond to questions that I have not responded to in the presentation at the end. So the CDC and the Department of Health have relaxed some of their guidelines, and we are adopting all of their relaxed guidelines. So anything that they've told us, this is what you should follow, that's what we're doing. And in most of these cases, it means that the restrictions are lessened, and that's based on their review of data from the last 15 months. So I'll go through each of these. In terms of symptom screening, that is any individual that has any of those symptoms that we are probably all familiar with because we needed to monitor for them all year last year. Those symptoms have not changed, and the requirement for screening is still in place. We did offer a daily screening option, and we offered an attestation that the parents could fill in once, basically making a promise that they would monitor their children daily, and they would keep their children home if there were symptoms. So that will remain in place. In terms of physical distancing, so if we are talking about a grade level where the children are eligible for vaccination, which right now represents only our junior and senior high schools, physical distancing is not required. We are currently at just over 50% of our eligible children who are vaccinated. And so that will continue, hopefully, to rise as people make the decision to get their children vaccinated, but it is not required. If we have in our elementary schools where the children are not eligible for vaccination, and that goes all the way up to grade 6, we will be using stable groups. And so with stable groups, physical distancing is not required. However, it is recommended that we have at least 3 feet between stable groups when we have indoor activities in shared spaces. We do have the capacity, even though we are using stable groups in the elementary school, we do have the capacity to maintain a social distance of at least 3 feet, and we will work to ensure to the maximum extent possible that 3 feet is provided, and that's both in the classroom, in the cafeteria, etc. So even though it is not required in the upper grades, we still will maintain a minimum of 3 feet. That's an extra mitigation strategy. And even though it is not required when there are stable groups in our elementary schools, which we will be doing, we will still maintain a 3-foot distance to the maximum extent possible. In terms of testing, so there are recommendations for us to continue to monitor for positivity, even in asymptomatic individuals. We did do that last year. We did not mandate it. We did not test individual kids if their parents did not give permission. I know that there was a lot of conversation across the state about older children. The law says that older children can consent for themselves to be tested. We did not do that. We are requiring parental consent, regardless of age, for any child whose family says, yes, you can include them in asymptomatic testing, random testing. And we will continue to do that. And again, it's just a way for us to monitor to make sure that there is not spread in our schools. And we are just unaware of it because the children are asymptomatic. That will happen only during periods of substantial or high transmission. It will be done in school by clinicians, certified registered nurses. We do have the capacity to administer the test and read the test, get the results within the day, and we will report results to both the child and the family. And again, if it is not something that you want your child to be involved with, then you do not consent. If you are willing to give us consent, then we will include your child in the weekly testing, but they wouldn't be tested every week. It will be a random sampling. We will test more kids in the highest category. If we have community transmission in the highest category, then we would in the substantial category, but we will only be testing in the 2 highest community transmission rates as defined by the Department of Health. Okay. And the other thing that I will say is if a parent is willing to have their child tested, but does not want their child to be tested by staff of the school, then you have every right to do that. And you can take your child to a testing location. We're happy to help you and connect you with locations that conduct testing. It will give us the same result, but you have the choice on where that test could take place. okay? Let's talk about quarantine. This is a big deal. Last year, as you know, we had a number of instances where positive cases occurred, both with children and with parents, and with staff, and also with parents. That resulted in quarantine and isolation. And in those cases, we stuck to the 14-day quarantine period, which was the gold standard defined by RIDE. We did change that to 10 days with a negative test on or after 7 days towards the end of the school year. The Department of Health is now saying that the recommendation is a 7-day quarantine. So if you are identified as a close contact, the quarantine period has been reduced to 7 days with a negative test on or after day 5. And if there is no testing, so if the parent does not want to have testing, then it's a 10-day quarantine. So it can go down to 7 as long as there's a negative test on or after day 5. If there's no negative test, then it's day 10. So it's a 10-day quarantine that includes weekends, and the child can return, but we are still required to monitor for symptoms for 14 days. No problem, because we monitor for symptoms all the time anyway. In terms of vaccination, I've shared with you that our percent of vaccinated students is roughly 50%. We continue, and that's at the eligible grade levels, we continue to offer opportunities within our community for those families, children and families who are eligible and wish to get vaccinated. It is not mandated, but we offer the opportunities for anybody that is interested. In fact, there are 2 community drive-up vaccination clinics that are scheduled in August prior to the start of school. Those clinics are held after work hours, after normal work hours at Metcalf, and it's a drive-up. So you drive up, take the test, and then you get the results shortly thereafter. At this point, we are not clear on whether or not vaccinations will be offered to younger children. We're hearing that that is going to happen at some point during the school year. We would not mandate it, but we can share information. You can make your own personal decision, and we will offer additional clinics to make it easy for those families who wish to get their young children vaccinated. In terms of cleaning and disinfection, hand hygiene, we will continue to use the same mitigation strategies that we used last year. Very successful. The cleaning of surfaces, the cleaning of desks, those kinds of things. Hand hygiene, making sure that children are washing their hands very frequently. We'll continue to do that. And in terms of ventilation, which is the last mitigation strategy, as we open up school, we anticipate that the weather will be good, just like it was last year, so that we can keep windows open in all classrooms, and that natural airflow is excellent. However, we also, at the junior senior high school, some of you may know, we have undergone a pretty massive construction project this summer in replacing the existing HVAC system. And we did put in a filtration system that does have a MERV 13 filter, which is the highest, which is the recommended minimum filter that would, get the particles out of the air. So that is in place, or will be in place, before the start of school. That construction project has gone pretty well. I mean, we have had a couple of delays based on the delivery of product, but we will be able to open school on time, and the HVAC system at the junior senior high school will be at least a MERV 13, which is terrific. On top of that, we also secured last year portable air cleaners with HEPA filters for every classroom in the district. And that is from preschool all the way up to high school. Those individual HEPA filters will remain in classrooms in all buildings. And so that is an additional mitigation strategy as well. And I want to go back to the issue of quarantine because there's some information that I know that some of the questions are coming up as well. Let's talk about a positive case that occurs. If we have a positive case, then we will be doing the contact tracing just as we did all year last year. And a close contact is defined as an individual who has been within 6 feet of a confirmed case for greater than 15 minutes. Now I need to finish because it seems counterintuitive, right? They say that we don't need social distancing. They're recommending in certain situations 3 feet, but a close contact is still somebody who's within 6 feet. But in terms of quarantining, it is possible for you to be a close contact, but you may not be required to quarantine in the following circumstances. If a child is unvaccinated and they were within 0 to 3 feet of the infected student in an indoor setting, so not outdoors, but in an indoor setting, for a total of 15 minutes over a 24-hour period, that's the same rules as last year, then they must, by Department of Health guidelines, quarantine. So you could be a close contact, you might be within 5 feet, within 6 feet, but unless you were within 3 feet, you're not required to quarantine, okay? If the child was unvaccinated and they were within 3 to 6 feet in an indoor classroom, they don't need to quarantine, but under certain conditions. Here are the conditions. If both students were masked, there is no requirement for quarantine. And the school must be following the state's most recent guidance on ventilation, which we are. And there must be one or more additional prevention strategies in place. And those include daily screening, which we do, routine asymptomatic testing when it's recommended, which we will do, hand washing and respiratory etiquette, which we will continue to monitor and encourage. Cleaning and disinfection protocols are in place, which we have. Ventilation is maximized, which we have. Promoting vaccination and making vaccination available, which we will do. Screening testing to promptly identify cases, which we do. Asking parents to keep their children home when they are sick, which we do. And that we are implementing the contact tracing protocols and also isolating and quarantining when required, which we do. So we are doing everything that we are being told would be helpful in limiting quarantining. However, if the child is unmasked, then the quarantine would be required even from 3 to 6 feet, right? So in other words, that the rules have changed a little bit. Last year it was 6 feet no matter what, masked, unmasked, it didn't matter, vaccinated, unvaccinated, it didn't matter. Now, only 0 to 3 feet would be required, and then 3 to 6 feet would be required only if the children were unmasked and there were no other mitigation strategies in place. We have the mitigation strategies, and masking would be required in certain situations based on community spread. That's where we sit at the current time. Okay, so I think that if we look at the rules that were in place last year and compare them to this year, in many cases, they have been relaxed. And that is because the data suggests that there was no real significant difference between individuals that were, for example, 4 feet away, 5 feet away, 6 feet away. There was no real significant impact of that on positivity, but there was a much more significant impact when the children were closer. So they've used that data to adjust their recommendations, which at the end of the day will keep more of our kids in school for longer periods of time. And that's ultimately what our goal is. So those are the current mitigation strategies. I'm going to stop because I know that we have questions, and I'm going to jump into the chat and try to address as many of these as possible. And then when Jeremy, if there are any that are coming from YouTube, you can jump in and let me know. Okay.
I'll send them to you as a direct message if there are.
Oh, good. Okay. So first question, just want to check, like last year, is there a virtual class or opportunities for students? So we are not doing full virtual classrooms. Last year, we did offer that at every grade level. But the governor and the Department of Health and the Department of Ed have indicated that children should be back in school. And so that's what we're doing. However, if there are children who are quarantining, meaning that they're required to stay out of school because of a symptom, they're required to stay out of school because they were a close contact, are there opportunities for them to stay connected to their classroom? Yes. We are not finished defining what that looks like at each grade level, but we will communicate that out. However, there are not separate distance learning classrooms that will start at the beginning of the year and be open for the entire year. Okay. If there is a positive case in a classroom at a time of low transmission when the class is not required to wear masks, will the class then have to quarantine for 2 weeks at home? If only those that are within 6 feet. So it still is the 6-foot rule, but because there are no masks, then anybody within the 6-foot radius would need to quarantine. It would not be a blanket statement for the entire class. However, let's be honest, at the preschool level, at the kindergarten level, there is no guarantee that children maintained the distancing because those are totally different groups of kids to manage. And so oftentimes at the younger grade levels, it does mean that the entire class would quarantine. And if that happens, the class will run virtually for that period of time, and the teacher will be the teacher of record, meaning that teacher is also involved. They may not have to quarantine because the teacher is vaccinated, but the teacher will run that class virtually. If we have lower transmission while mask wearing, it's because we are wearing masks. You then lift the mask rules, it will naturally go up. We had low transmission last year because of masks. We still had children get it, but luckily the kids were wearing masks. True. And again, it's really only the lowest transmission rate where masks would be optional. And again, that's based on the recommendation. It is not a policy that has been adopted yet by the school committee. More discussion will happen, but that's where we currently are. Okay. Address that one. Are we going to have 2 elementary runs again, or are we going back to 1? Great question. We are going back to 1 run. There are no more restrictions on the number of passengers that can ride the school bus, which is the reason that we had to go with 2 runs. That means that school will start and end at the normal time for all kids, and specials will happen in the school building. So there are not 2 separate runs, and there is not a shortened day for elementary children. Hopefully that's good news for you. So how often would the data be monitored for the policy, and who would be required to share this information with the parents and staff? There is a place on the Department of Health website where they do update the information by community on a week-by-week basis. We have been promised that we will get the community rates on Fridays so that we can communicate that information out to parents on Fridays, and you would know if there is a change in masking on Friday for the following week. So it would be a week-to-week basis, and that spread is based on the prior 7 days. Okay, so it's not like you have one day where it spikes and therefore the mask policy changes. It's a 7-day average. So that information, again, based on what we've been promised, would be available to us on Fridays. I would then share that out with the principals and with the families on Fridays, and also indicate what that means in terms of masking at each grade level. Okay. All right, so a good question about if there are children with known medical vulnerabilities at the elementary level, are there additional plans or considerations to ensure their safety? So if there are additional strategies, and remember I said that the Department of Health listed like 8 different mitigation strategies that districts could put in place, and we are putting every single one of them in place because we can. But if there are additional safety and mitigation precautions that we could make, then what I would ask is that you connect with the principal of the building and ask for a medical review meeting so that we can talk together about additional strategies that might be effective for the individual child based on the medical condition, the medical vulnerability. And if there are additional things that we can do to mitigate, we're happy to do that. But we would require a conversation with the parent because you know your child better than anyone, and you can help us identify the best strategies that may not already be in place. And we'd be happy to work with you to get that, to make that happen. If I, as a parent, want my kids to wear a mask and have had the communication with my kids, will that choice be honored? Absolutely. Absolutely. So in the circumstances where the mask would be optional, and at this point, it doesn't look like that will be the case for the start of school, but let's say we get to that point where, according to the policy, if the policy is the one that's adopted by our school committee, is the one that we go with, and parents want their children masked, even though it's not required, then that choice is absolutely honored. Many adults will also be wearing masks, even though they're not required to. And if you want to communicate that information to your child's teachers, that you are requiring at the elementary level for your child to be masked, even during periods where it's not required, we will help to monitor that situation for you. It absolutely will be honored. How do we report our child is vaccinated? We actually know that information. The information is entered into the KidsNet portal, which is manned and monitored by the Department of Health. And our clinicians, the school nurse teachers, do have access to that information. So just like we have access to required vaccinations, we also have access to COVID vaccination status. If on top of that, you want to voluntarily share the vaccination card, just to be crystal clear that the school nurse knows that your child is vaccinated, you're free to do that. But you can also just send an email or make a call to the school nurse at the building to confirm that they have the right information. But it is not something that we're requiring you to submit, because our nurses already have access as medical professionals to all vaccinations, so that we can monitor those required by the Department of Health. And now we can also monitor our percentage of fully vaccinated individuals at the school through the same system. Okay. Okay, so the Rhode Island website on COVID has West Greenwich at 0. It does not. So what I can do is tomorrow, when I share out the summary of the recommendations to the entire school community, you'll all receive it. I will also share with you the link and an explanation for what exactly I will do on a weekly basis to determine what the 7-day average transmission rate is for each individual town. So you have access to the same page that I will be looking at. And on top of that, we are going to be emailed the transmission rates by community, as I said earlier, on Fridays. So I will be able to monitor to make sure that what I'm getting from the Department of Health matches what's listed on the website. But we've been told as superintendents that they promise that data will be up to date on a weekly basis, because they know that many districts are moving forward with a tiered masking system. And in order for that to work, we have to have access to good, solid, up-to-date data. So I'm not sure what you are looking at that shows 0, but I will share what I'm looking at so that you have access to the same information that I have, and that will go out tomorrow. Okay. Will the school times be normal this year? Yes. Will there be art, music, etc.? The answer to that question is, in general, yes. However, just so that I'm clear with everybody, we do have some vacancies, some part-time vacancies, because we have some staff who have requested leaves of absence or job shares. And we are having a really difficult time finding staff to fill those particular vacancies. So we will have specials. They will happen during normal school times. There will not be a shortened day, but I cannot promise you that every child will get the typical specials that we've always offered. They will get something. It will be engaging, but it may not be art, for example, for all kids, because I may not have a teacher who is certified to deliver that instruction, even though we've tried, we've posted, we've interviewed. We're just having a difficult time. So we'll let you know what we will be offering, but they will have something, and it will be during the school day. Okay, so masks or no masks, it's not a yes or no conversation. It's a tiered system based on community spread, and that is being voted on tomorrow. I'm only sharing recommendations, and then it does require a final vote of the school committee. If EWG has a 0 number, then how can it be substantially high? It can't be, but we're looking at different information. So again, I'll share that with the community. If there is a positive case in the class, the entire class would follow those quarantine guidelines. Not everybody in the class would be required to quarantine, only those that are within 6 feet and unmasked. So I hope that I addressed that question. That question, I think, came in before I talked about that. Okay, when you say close contacts need to quarantine for 7 to 10 days, depending on if you get a test in day 5 or later, right? So if it's a 7-day quarantine, if there is a negative test on day 5 or later, 10 days without a test. Is this the period in addition to the isolation period of the infected, or 7 to 10 days from the date of exposure? So it is 7 to 10 days from the date of exposure. And for the positive case would be isolating. So they would be removed from the class and required to isolate for a period of time. This is just about close contacts, and it would be from the date of exposure and 7 days with a negative test on or after day 5. If the child is sick and therefore stays home, will there be a distance learning option? So I think I mentioned that as well. There will be options for the kids to stay connected, but we will not have a separate teacher. And so we're still working out the details on how that will look, and we'll communicate that out once we solidify those details. Okay. Okay, so we do not have separate distance learning classrooms this year. And that's based on the guidance and recommendations from the Governor's Office, the Department of Education as well. Is the next form identical? It is, except I will talk more about secondary. There are certain things that are relevant only to elementary at the secondary level because the kids are all eligible for vaccination. Some of the requirements are a little bit less restrictive, but for the most part, the form will be the same. Quarantine for travel is, we have not received that information yet, but I am assuming that it will be similar to last year. I've asked the question, but I've not gotten the information yet in writing. I assume it will be similar to last year, depending on the positivity rate in the state or country that is visited. There will be a required isolation quarantine period after travel for non-vaccinated individuals. But I do believe that that period of time will be reduced from what it was last year. And I think it will mirror the 7-day with a negative test after day 5. Okay. Okay, if there are 2 children from the same family in the same grade, will they have to be scheduled for the same classroom? Yes. An exemption for mask wearing would only be because of medical documentation that would require a medical meeting, and we did have a couple of kids that was the case for last year. However, there do have to be additional mitigation strategies that are implemented. So the sooner we know, the better. That would be a contact directly to the school nurse so that a meeting can be scheduled. Okay. Will we be made aware of positive cases in a classroom, even if our individual child is wearing a mask? Yes. PE and other specials? Yes. Okay, some math questions about if low transmission rate is 0 to 9.9 per 100,000 people, and EWG population is around 13,000. Does that mean that if 2 people test positive and exit West Greenwich, kids will be wearing a mask? Remember that this is a 7-day average, and let me just do a little bit. I'm gonna copy that question down so I can answer it more precisely, and I'll send that out as part of the communication that goes out tomorrow as a follow-up. Will masks be required on buses? Yes. That is a federal mandate, and so there are no exceptions. All public transportation, including school buses, masks are required. Outdoors, no masks, correct. And in fact, we will be continuing to take advantage of outdoor learning time. We have outdoor learning spaces, mask breaks built into the school day frequently. So anytime the child is outdoors, no masks are required. Policy for students that are previously tested positive for COVID. That's another question that I don't have an answer to yet. last year there was a 90-day period that the child was considered to be basically immune for COVID, but it was a 90-day period only. I am not sure that that is still in place. I have not gotten clarification on that. It's a question that is still out there. Okay. Do we know what percentage of our staff and teachers are vaccinated at this point? We do know that, and it's extremely high. I am not able to release personal information on staff members. However, we have a very, very substantially high fully vaccinated staff. The rate of vaccination is high. Will they have lunch in their classroom? No, they did not have lunch in their classrooms last year for the most part either. We still have cafeteria, we still have recess, that's outdoors, but in the cafeteria, the kids do sit as a class, but they are not in the cafeteria alone. So nothing will change there. Will sixth graders be switching classrooms for subjects? There are some grade levels where switching will occur, but the switching basically is one group of kids that moves from one classroom to another for, one teacher does math and science and the other does ELA and writing and social studies. So that will continue, but the kids will travel as a group. That will happen next year as well. The school start date, the calendar was adopted last year. It is on the website, and I'm thinking off the top of my head, the teachers return on Monday, the 30th. There are 3 days of professional development and orientation for teachers only. So that's the 30th, 31st, and the 1st. And then the 2nd and the 3rd, kids are in school. That's the Thursday and Friday. And then after Labor Day, they're back full time. After school care be available. We still have the Y. We are working out details on how we will manage that for Wawaloon, but the Y will run just like it did last year at Metcalf. Ali, you're on the meeting. A parent is asking the normal day schedule, the start and finish time. Can you just tell me the exact start and finish time for Metcalf?
Yeah, let me think, because we were in two different. 8:22 is arrival, and the kids have to be in the building by 8:37, and then dismissal is
3 o'clock.
2:50 and 3 o'clock, right?
3 o'clock. Yep.
Thanks.
Okay, thanks. And then Wawaloon is like 5 minutes off of that schedule because the same buses are used to drop the kids at both buildings.
I believe it's 10 minutes.
10 minutes. Okay.
Yep.
So I'll include that in the updates tomorrow as well when I send that out. Okay. Parent volunteers. So we are going to limit volunteers, but we are going to allow volunteers. So it won't be just an open invitation for everybody under the sun, but we are allowed to have visitors and volunteers in school buildings. That will be communicated by the principals. However, it's preferable that those individuals are vaccinated and they must follow all of the safety precautions that are in place. Okay. Will the kids need a negative COVID test to return if they're homesick with a stomach bug or cold? No. Same as last year, they need to be symptom-free and they need to be fever-free for at least 24 hours. That rule has not changed. Okay. Okay, what will be the protocol if the instructor comes down with COVID? Same. So if the teacher is positive, then they have to isolate and they have to quarantine anybody that was within 6 feet or 3 feet. 6 feet if not masked needs to quarantine. It's the same rule. The issue will be that the teacher would not be present, and we would have a sub available for that building for that classroom to continue with instruction for the remainder of the students. Okay. Okay, so anybody that received this communication about the community forum, you're already on the list and you will receive any communications and updates that I send out. If you did not receive directly this communication indicating that the forums would be held, then if you send me personally an email, I'll make sure that you get added to the list, and that way you'll receive any communications that go out. Is there an opportunity for my child to get a tour of the school before the first day of school? Yes. Principals are going to manage that. And I think I met with principals today, so something will be going out explaining how that could happen. If the state mandates masks, will the district comply? Yes. Will parent, teacher, and IEP meetings be held in person? We are providing options for parents. We'll hold them in person or virtually, depending on the preference of the parent. Walloon start and end times are within 5 minutes or so of the Metcalf start and end times, but I'll send that out tomorrow, exactly what the times are in my summary. Okay. If a child has a cold with congestion and sore throat, do they need to get tested? No. Last year, 2 symptoms warranted a COVID test. So I have to refresh my memory on that. I think that there are certain symptoms that a test is required. I am not sure if the rules have changed on the symptoms that are not those big 4, but that did not show up in the most recent guidance that we were reviewing. I will ask that question just to be clear, and I'll get that information out tomorrow as well. So I did skip over a couple of questions, and I referenced them, but a lot of people are asking similar questions about, what does that mean in terms of a total number of individuals in my town who end up testing positive? How does that translate to the transmission rate, the 0 to 9.9 for low transmission? I want to be clear in the way that I answer that question. So let me just do a little bit of background research on that so I can send that information out to everybody. But I don't want to speak out of turn on that. I want to be clear in my communication. I will get that to you tomorrow. Negative effects of masks on children. Again, no one wants to wear a mask. The staff does not want to wear masks. Most of the kids don't want to wear masks. Many parents don't want to wear masks. They don't want their children to wear masks. I am not a scientist. I am not doing a study of negative effects of masks on children. I don't have the capacity to do that, nor the expertise to do that. So I'm doing the very best that I can. I do understand that, there certainly are issues that our kids have experienced over the last 15 months related to educational impact, loss of learning because of quarantines and school closure, mental health issues for a variety of reasons. All of those things are things that we take very seriously, and we have put a lot of things in place to address to the maximum extent possible to address those concerns. We have a lot of resources that we've secured to assist. And so, you know, that's the best that I can tell you. I don't have the capacity to do those studies. I need to rely on information that is shared. And I said at the very beginning, there are people that have extremely opposing opinions. And no matter what is decided, it will not make everybody happy. And so I, again, am put in a really difficult position. I think I've come to a reasonable compromise. And again, that's my recommendation. It will be discussed tomorrow, and we'll see where the vote is. Okay, bus schedule. The bus schedule usually comes out the week before school, so I would anticipate maybe towards the end of next week or the beginning of the following week. We did have some communication with the bus company today, so we're working out some final details, and that certainly will be shared. We'll send it out. We'll put it on our website for the school, and it will be released in all the normal formats over that you know we followed in previous years. Okay. Will all grades be at the same time on the same bus from Metcalf? Yes. So no reduced day like we did last year. No restrictions on the buses. Okay, travel and quarantine requirements. So I thought I did, but I'll repeat that. I believe, although I do not have it in writing, but I do believe that the quarantine requirements will mirror the quarantine requirements for close contacts, because that was the case last year. So if an unvaccinated individual travels to a location with high transmission, then they would be required to quarantine. But unlike last year, the quarantine would be reduced from the 14-day gold standard to 7 days with a negative test on or after day 5. And if there is no test, then it's a 10-day quarantine. So it's reduced, but there is still a requirement for quarantine when travel occurs to a high spread location. Are school committee meetings held open to public in person or still virtual? They are held open to the public in person. The school committee meeting tomorrow is at 6 o'clock and will be held at Metcalf School. However, parents, community can also access the meeting virtually. There is a link that allows you to access the virtual meeting on our website. So you actually have an option to attend in person or attend virtually, and you can comment both in person and virtually on any agenda item that is up for discussion. Will we be dedicating the first month to SEL again? That's social emotional learning. Actually, social emotional learning is a really important part of our day. It is something that we focused on not just during the first month, but throughout the entire year. And we will continue to do that next year. We have increased our clinical staff so that we can respond to the growing social emotional needs. Some of our kids have experienced trauma. Some of our kids have experienced death in the family as a result of COVID. Some of our kids experience trauma for other reasons as well, but it's magnified. We know that. We have also increased our supports for academics at all of our buildings. We have some creative scheduling that allows for more intensive support of kids who are in need, who have experienced some loss of learning based on not being able to come to school for a variety of reasons or not having in-person learning consistently. So that will all be communicated as well, but we've used the money that's been made available to us from the federal government for the stimulus relief to really pay attention to academic and social emotional needs. We've managed all of the additional costs through our own budget and through cost efficiencies and transfers of funds from one funding stream to another so that we could use the money that's been made available to us to directly support social, emotional, and academic needs of kids. So that's pretty exciting for us as well. We are really, really prepared to welcome all children back. And, you know, we're looking forward to it. I know it will be difficult, but, you know, I think our track record, I'm not saying that we were perfect, but we did a really decent job last year and the year before, and I anticipate that it will be the same going forward. And we'll continue to make the best decisions that we can. But it's challenging, right? I mean, I will not make everybody happy, but I hope that at least everybody can understand that we are listening and trying our best to compromise but maintain safety based on the information that we have available to us. Okay, I think I have addressed everything that I can, and I've taken notes on the things that I promised I would get back to you on. Again, I will send out a summary of this information tomorrow. It will not be until later in the afternoon tomorrow, but it will go out. And if I missed anything, just send a response to me, and I will make sure that I get that out to you. Jeremy, can we just save the chat and send me a copy of the chat after this meeting, and the same for the next forum as well, just so I can refresh my memory on the questions that I said I would respond to?
Will do.
All right, thanks. Okay, it is about 7:10. Any last minute comments or questions? Hopefully this was informative. And I'll continue to share information as it becomes available. Thanks, everybody, and have a good night.
Thank you, Jim, very much for doing the forum. I really appreciate it, and I'm sure all the parents do too.
Thanks, Lori.
Jim, you're a master communicator. I'm proud to work for you. Thank you.
Is that Karen?
Yes.
All right. I only recognize the voice. See? Thanks, Karen. I appreciate it.
Yeah, really great.
Karen, I've been saying the same thing to my husband, like masterful, excellent communicator. Thank you, Jim.
Yes. Very, very well done.
Appreciate it.
Okay, I'm gonna go ahead and end the meeting now, and I'll see you at 7:30, Jim.
All right. Appreciate it, Jeremy. Thanks.